Do you have high blood pressure? Do you take medications to lower blood pressure? Captopril, nalopril, myosartan, losartan, diuretics like hydrochlorothiazide, furosemide, or even other medications like atenolol, metoprolol, or amlodipine. In this video, I will share 13 natural tips to help you have the greatest success in treating high blood pressure. These are proven tips that really work to lower blood pressure. I'm not going to sell you any medicine or supplements for that purpose. So please like and share this video. Let's make a goal of 10,000 likes. It's very important that you help YouTube understand that this video is important so that it distributes it to more people. It is estimated that in Brazil, Portugal, the United States, and Japan, 30% of the population is hypertensive and has high blood pressure. Let me know where you are from. Do you have high blood pressure? What's your city and state? The last 3 tips are the ones that work the most, but it's very important that you do them all. You just have to promise me that you won't stop any type of medication without first talking to your doctor. But your treatment success rate is going to increase a lot. The first tip is about cocoa. Scientific studies show that if you consume dark chocolate, a concentration greater or equal than 70% cocoa, you can benefit from lower blood pressure. And what would that quantity be? 30 grams of dark chocolate per day. You might think, but if I ingest a lot more, will I get a bigger benefit? No, you're just going to increase your calorie intake and it won't benefit your blood pressure. So 30 grams, a small tablet or piece of dark chocolate can help in the process of reducing blood pressure. And the second tip, avoid refined sugar, table sugar, cooking sugar. And this goes for crystal sugar, demerara, cane sugar, molasses. All of this will increase your pancreas production of insulin because your blood sugar will rise, even in those who aren't diabetic. For diabetics, it goes without saying, but it'll happen even if you're not. To compensate, your pancreas ramps up insulin production, causing an insulin spike. Insulin affects the kidneys too, leading to more sodium reabsorption. With the sodium, water follows, leading to increased fluid retention and consequently higher blood pressure. So plain sugar is really bad for your blood pressure. You might think, I have some once in a while, no big deal. The issue here is excess. You should avoid it, not eliminate it entirely, all right? So remember this because you always ask, but don't you have a little sugar? Sure I do. I'm also a child of God, so I have a little sugar. But too much is harmful and has that effect. Number 3, potassium-rich foods like avocados, dark leafy greens help you. Why? Potassium also has a relationship with blood pressure. For example, if you swap sodium chloride for potassium chloride, table salt for light salt, just by doing that, you already have a decrease in high blood pressure, okay? In blood pressure. It's important to emphasize here that patients who have kidney insufficiency first need to speak to a doctor before any switch, before consuming avocados, bananas, foods that have potassium. Why? When your kidneys weaken, you struggle to eliminate potassium. It can become difficult. So before you increase your intake, it's important to consult your doctor because an increase in blood potassium can cause arrhythmias, for example. Number 4, sleep. A minimum of 6 to 8 hours a day. And here it's important for you to know the quality of your sleep. If you're waking up many times during the night or if you snore, you might have obstructive sleep apnea, a major cause of high blood pressure. So pay attention to how your 6 to 8 hours of sleep are going. Ask the people who live in the same house if you snore, for example. Sometimes you might snore, but no one tells you, so it's important to ask. Since I brought it up, number 5, know the cause of the increased pressure. There are many causes, for example, thyroid disorders, increased cortisol, sleep apnea itself, where you stop breathing for a few seconds during the night, can greatly increase your blood pressure. So it's very important for you to know the cause. Get screened. Also, directly ask the doctor, what is the cause of my high blood pressure? Often there is something called secondary hypertension. You're hypertensive, but it's due to some other illness. It's estimated that 5% of people have this type of hypertension, which you can manage. If you address the cause, you can resolve your problem. If you treat something like a thyroid issue, you'll see your blood pressure improve. Then you might wonder, isn't 5% quite a bit? That's over 1 million people, so it's quite significant. Number 6, breathing. Exactly, by breathing you can lower your blood pressure. You can quickly improve hypertension. This is included as supportive treatment in Society of Cardiology. So this is not something I came up with. I'll put the source in the video comments. The references, so if you want to do more in-depth research in more technical terms, especially if you're a healthcare professional looking for more detailed information, all the advice I'm providing here is scientifically backed and I have the proof. So I'll leave the link in the comments for you to access. And what's the breathing like? I'm going to teach you now. You need to breathe 6 times a minute for 15 minutes. It could even be a little less, but most study references say 15 minutes. What would that then look like? Each breath, on average, you have to give 10 seconds between inhaling and exhaling. So I'm going to do an example here. That's 6 times, okay? 5 seconds to inhale, 5 to exhale. Of course, I had the timer ticking. I'm not sure how long it was, but if you do 6 exhales per minute, you can have a benefit in reducing your blood pressure. Look how important that is. Thanks for your like already. So if you didn't like this video, you've already helped more people know about this tip. Number 7, limit your alcohol consumption. There's a large controversy about alcohol and cardiovascular risk. Why? Up to 1 drink per day, you would have a reduced cardiovascular risk. The risk of you having high blood pressure, for instance, because you have a vasodilation, the vessels become more relaxed. After 1 drink, this risk greatly increases. So, what's the key here? Limit it to 1 drink per day, okay? So, limit your alcohol consumption. Number 8, completely stop smoking any type of cigarette. And if you already knew, I know this tip isn't new to anyone, but cigars, hookahs, electronic cigarettes, all of these cigarettes are bad for your health. Quit smoking altogether. Number 9, be careful with blood pressure measurements. When are you going to measure this blood pressure? Why? Studies show that the rate of people who have what's called white coat hypertension, hypertensive people, people with high blood pressure, only when they go to consult is quite high. Sometimes you have normal blood pressure, but when you go to the doctor, pressure increases and you end up taking medication for it. There's also another type called masked hypertension. You're hypertensive, but at the time of the consultation, your pressure drops and you're more relaxed. When I'm at the doctor's, my blood pressure stays under control. If you have either of these 2 types, write in the comments because it's quite common for people to have high blood pressure only during the consultation. What's the advice here? Measure in other situations. Measure outside of the doctor's office. So if you're near a pharmacy, measure your blood pressure to see how it is, to see if you don't have the white coat pressure. It's not a joke. Sometimes I warn my patients. You might have the white coat pressure. Take measurements elsewhere. People laugh. This has happened several times because it's not a name I made up. White coat hypertension really exists. Number 10, we're nearly at the top 3 most effective ones, but this one's very important. It's about coffee. If you consume up to 3 servings of coffee a day, what would 3 servings be? 3 espresso shots, 50 milliliters, or 3 cups, 200 milliliters of brewed coffee. You'd have a benefit in terms of cardiovascular risk, a reduction in the risk of having a heart attack, for example. It can indeed improve your blood pressure levels. Why is this so hotly debated? Because if you go over that amount, remember what I said about alcohol, it can be harmful. Your blood pressure may rise due to the excess caffeine, and it could even trigger arrhythmias, for example. So watch the amount. Up to 3 servings of coffee a day, you do get a benefit. And it's very important here to stress and make it really clear about each person's individual sensitivity to coffee. So it's important that you measure your blood pressure and see. I drank coffee after 2 hours, my blood pressure was average. Take a blood pressure measurement to see if your pressure doesn't increase because of the coffee. You have to be really aware of this, but in general, on average, I'm talking about scientific studies here, up to 3 cups of coffee a day can actually help reduce your cardiovascular risk. Let's get to the 3 tips that work the best. And the 11th, you've probably already guessed it, physical exercise, that's right. If you do physical activity, 150 minutes or more per week, what would that be? 30 minutes a day, 5 times a week. That can really help. And in a proven way, it helps a lot in controlling high blood pressure. In some cases, you can even reverse it with just physical exercise. And then you ask, well, what kind of physical exercise? Whatever works best for you. Walking, swimming, running, you can exercise in the street or at the gym. Don't impose too many limitations. Focus on doing 30 minutes 5 times a week. You'll already see a big benefit. Tip number 12, maybe the most important tip in the video. Just knowing this will reduce your chance of having a heart attack, a cardiac arrest, a stroke, or a cerebrovascular accident by 40%. It's about limiting your intake of sodium and salt. What values should you aim for? Up to 5 grams of salt per day or 2 grams of sodium. It's important to distinguish between the two, okay? Many think like, but I don't add salt to my food. I use very little salt, but they consume an excess amount of sodium. So you have to check the foods you consume. If you're not doing this, be cautious with olives, instant noodles, bacon, salami, sausages in general, processed foods and foods that come in packets. Check to ensure you're not consuming too much of these. According to the World Health Recommendations, it's estimated that here in Brazil, the average is 10 grams of salt per day. It should be 5. And in Portugal, it's 11 grams of salt per day. So it's crucial to pay close attention to this. If you take this advice, it's already well worth it. And tip number 1, which works wonders, is weight management. If you have hypertension, reducing your weight between 5 and 8% gives you a much higher success rate in the treatment. So focus on weight control. This tip can really help too. If you're not subscribed to the channel yet, and you want more videos like this, then subscribe and ring the bell, press on the bell icon, and choose all the options. Now I have a recommendation for you. It's a video where I gave 7 tips for you to quit sugar to lessen your intake. Remember how I said that it's also key to lowering your blood pressure? So check these tips out, I'm sure you'll like them. And up here, I'm going to leave a playlist about diabetes in case you want to learn more. Take care, see you in the next video.